Keeping Medicaid costs low means making budget cuts, but who should pay for them? Hello everyone and welcome to Comcast Newsmakers. I'm Robert Trenum. We are here on location in our nation's capital for the National Association of Counties Legislative Conference, and joining me is Commissioner Toni Preckwinkle, member of the Board of Directors of NACo. Welcome to the program.
Thank you. Thank you for inviting me.
So we all know that Medicaid is extremely important at the federal level, but also at the local level. Why?
Well, for us in Cook County, and I'm president of the board there, 35% of our budget is health care, and a lot of our county resources go into the provision of the social safety net in the county. We provide $500 million of charity care, what's called charity care elsewhere in the country, to the people of Cook County. And Medicaid is one of the ways in which we get federal support for the care that we provide.
And these are for people that are living paycheck to paycheck, perhaps maybe have no paycheck whatsoever, to get basic medical health needs, correct?
Right. We're talking about the working poor when we talk about who's covered by the Medicaid program.
Talk to us for a few moments about what it means if, in fact, there are significant cuts at the federal level. We hear the conversation over and over again that we're spending much more than we currently are taking in. We also know that we're in the middle of a financial mess overall. So what does it mean at the local level?
Well, you know, Dr. Ram Raju, who's head of our healthcare system, always says that you can only be as good health as the community around you. So if the people that you ride to work with on the bus, or the people who serve you in your restaurant, or the people in your office don't have access to good health care, that has an impact on you. You can't be healthy unless the entire community in which you live is healthy. And Medicaid is one of the support systems for a healthy community.
So what is the solution when we hear our federal lawmakers say that we must live within our means, that we simply cannot afford to provide all of the services that we're currently providing? What is the solution?
Well, first of all, I can't speak on behalf of NACo. I can only speak on behalf of myself, and frankly, I don't even have the permission of the Board of Commissioners to speak exactly in the way I'm going to. But, you know, my view is that we've invested an incredible amount of money in the last decade in 2 foreign wars, and that we need to wind down those operations as quickly as we possibly can and make investments in our own country. And one important investment that we have to make is in health care.
And to the viewer at home that's watching this program, what is the one takeaway that they need to know in the context of Medicaid? What is something that perhaps maybe you do from a Medicaid services perspective that they may not be aware of?
Well, I'm not sure how up your audience is on the Medicaid program, but Medicare is for seniors, so if you're 65 and over, you're covered by a federal program called Medicare. For those who are 64 and younger, it kind of varies state by state who's eligible for Medicaid. In my home state in Illinois, it was basically a program for children and for the disabled, and it will be expanded, of course, in January to include an income threshold. So people who are the working poor will be eligible, and it'll be mostly for single adults, couples, families whose income threshold is, I think it's $15,000 for in Illinois, anyway, $15,000 for an individual, $20,000 for a couple. So this is help for low-wage workers who don't have access to health.
The working poor, if you will.
The working poor who don't have access to health care on the job.
And I think that's very important because we all hear that health insurance is extremely expensive, and arguably it's one of the most expensive line items, if you will, in a family's budget. So if in fact you're making $15,000 a year or less, this could be a significant boost for you as well.
Right. Now, it's not just the people who don't have insurance that the expansion of Medicaid will help, but it's also people who have a threshold that they have to pay out of their own pocket before their insurance kicks in. Some employers provide insurance, but you've got to pay $1,000, $2,000, $3,000, $4,000, $5,000 out of your own pocket.
Sure.
You don't have it. If you're the working poor, you don't have it. And so you're dependent on our public health care systems.
All right. Well, thank you very much for joining us. Really appreciate it.
Thank you.
And thank you for joining us for this edition of Comcast Newsmakers. I'm Robert Trenum. Have a great day. Bye-bye.